Hi there. My name is Dr. Stephen Bills with TellMeMD. Did you know that medications that you take or things that you use on your skin can actually cause problems with sunburn, with sun exposure, and make us more prone to heat stroke? Did you know? Did you? I will go through some of these medications that we need to be careful with when we're out in the sunlight. I will list them below in the information section so that you can read them in more detail. Stick around. We're going to talk about it. I think most of us are aware that sunlight can be very helpful to our health. We know that sunlight increases the vitamin D production in our skin, which is needed for healthy calcium metabolism. It is excellent for sort of helping out with the circadian rhythms, which helps with our mood and it helps with our sleep. However, too much sunlight can also be counterproductive. Sunlight can cause sunburns, of course, but it also can lead to skin cancers due to ultraviolet irritation of our skin. There's also the issue of heat tolerance. When we're out in the heat, we can have problems associated with heat exhaustion or heat stroke at its extreme. It can also lead to dehydration due to excessive sweating, which makes us more prone to those first two. Here are some medications that we need to be concerned about. If you're on these, you need to avoid excessive sunlight. Alpha-hydroxy acids that are commonly found in exfoliants or placed into cosmetics can make us more prone to sunburn. Certain antibiotics, such as the Fluoroquinolones, things like Cipro and Levoquin and ofloxacin, the Tetracyclines, doxycycline, Tetracycline, and Sulfa antibiotics, specifically Bactrim, are medications that, if you're on them, will make you much more likely to get a sunburn or a skin abnormality because of that. Certain antifungals, like griseofulvin, can cause problems, so you need to be careful when you're taking those medications and you're out in the sun. Antihistamines. Antihistamines, like even the over-the-counter ones like Benadryl and Zyrtec or Claritin, can cause problems with sun exposure. Certain antipsychotic drugs like haloperidol, otherwise known as Haldol, are another things that we need to be careful with. And then the more common ones like blood pressure medications, amiodarone, quinidine, calcium channel blockers such as nifedipine or diltiazem, ACE inhibitors such as enalapril, and the angiotensin II receptor antagonists such as valsartan are blood pressure medications that make us more prone to heat exposure and to sunburn. Cholesterol-lowering medications, any of the statins are problematic when we're exposed to too much sunlight or to heat. Diuretics, things that make us urinate more to get rid of excess fluid for like leg swelling and congestive heart failure, specifically thiazide diuretics, Lasix, trimetoprim, hydrochlorothiazide are medications that make us more prone to heat stroke due to dehydration and to even heat exhaustion. So we need to be careful of those and stay hydrated or limit our exposure. Non-steroidal anti-inflammatories that we typically have in our house that we use over the counter, like Motrin or naproxen, which is Aleve, are medications we need to be careful of if we're taking them when you're out in the sun. Oral contraceptives and estrogens, medications that we use for overactive bladder, like oxybutynin, are medications that make us much more prone to heat exhaustion and heat stroke, so we need to be careful with those. Certain phenothiazines that like we use for anti-nausea medicine, like Phenergan, promethazine, are medications that we should be careful with when we're exposed to the sun or to the heat. Another set of medications that we frequently have problems with, specifically sunburn issues, are the retinoids, like the acetrin, medications that are used in dermatology to take care of certain skin conditions make us much more prone to sunburn. We talked a little bit about Bactrim being a sulfa drug, but there are also other medications that are used to treat diabetes that include a sulfa-like chemical, specifically glyburide and glipizide are medications that we need to be careful with if you're out in the sun. Not all antidepressants, but the older tricyclic antidepressants, amitriptyline, nortriptyline, doxycycline, imipramine, are also medications that make us much more prone to heat exhaustion and heat stroke. So here's a couple of tips that you can use to help with that. Stay cool, stay hydrated, wear sunscreen, limit your sun exposure or your time in the sun, and in general, try to stay cool. If you're on those medications that we talked about, just know that you're at higher risk of developing sun exposure issues or make you more prone to heat stroke, heat exhaustion type symptoms. I hope that you stay cool. I hope that you be careful. Stay safe.